Hello, I'm Dr. Q Fan. I'm a board certified urologist, and today I'm excited to share with you some techniques that I do in my private practice that help to reduce the patient anxiety and discomfort during the procedure that I usually do in the office, such as transrectal ultrasound guided biopsy of the prostate. As you know, usually patients are very anxious and very uptight when they have any procedure, especially the biopsy of the prostate. It's a sensitive organ, a sensitive area. And so what I usually start out with is I tell the patient that please participate with me. If you do this, your pain and anxiety will be as a minimum. So what I tell the patient is, please tell me what you like to do, what you enjoy doing, what your hobbies or anything. Keep on talking, and when you talk about that, your pain and discomfort will be much less. So the patient will, most of the patient will do, but some patient doesn't have anything to talk about, and I ask them about traveling, what you like to do, and they talk about traveling. I just facilitate. I don't talk much about what I like to do or where I like to travel, but what the patient like to do. Some patients like boxing, some patients like deep sea fishing and skydiving. So I said, oh, that's great, tell me about that. And during procedure, I just focus on what I'm doing, and all I have to do is just, oh, really? Really? That's exciting, huh? So I just do that, and patients keep on talking. And sometimes when I finish a procedure, and the patient's still talking, and they had a good time. They told me that I have good bedside manner, and then they love it a lot. But there's some cases that tough patient. One example is I had a rabbi, and he said he no hobby, he doesn't travel, he's very serious, and he doesn't like to talk about anything. So I came up with an idea that, oh, let him teach, because he liked to preach, to teach. So I asked him, I didn't know what kosher means. So I said, so Rabbi, could you please do me a favor and teach me about kosher? So he said, oh yeah, kosher is then, and he keep on going on and on. He said kosher depends on the kind of animal, kind of fish. Some fish are kosherable, some fish not. You had to have the scale, and some animal, even the same animal, but he said it had to be prepared a certain way, and if it's not prepared right, it's not kosherable. So we keep on going on and on, and by the time I finished the prostate biopsy, 15 minutes later, he's still teaching, preaching, and he said he didn't feel a pain or anything during procedure. So the lesson I learned is talk about what the patient feel comfortable about talking, or they like to talk about, and facilitate them to talk about that, and that will help them a lot. So try these tips next time you have any procedure in the office. And thank you.